Welcome back to The Listening Doctor. I'm Dr. Sowmya Josyula. Today we explore a powerful truth in primary care, the first 3 minutes of a consultation, and how it can change everything. These early moments aren't just formalities and introductions, but they are opportunities to build trust, create safety, and allow for a healing process to begin long before we reach for a pen or a prescription pad. Let me share a story that shaped how I approached those first 3 minutes. She was a 34-year-old, a young mother, carrying more on her shoulders than most people ever realize. She had 2 children, a 10-year and a 5-year-old. She worked part-time in her college cafeteria, and she was trying to complete her master's degree in sciences at the same time. Her life was a constant juggling act, and she was tired, far beyond the kind that sleep fixes. She walked into my clinic, tearful, guarded, and exhausted. Her words came out in loops. My whole body hurts. Nobody understands it. I can't keep living like this. She had been living with this pain for years. She had seen several doctors, tried different painkillers, antidepressants, anti-anxiety medications, but nothing helped. Some medications even made her more drowsy, more irritable, and more disconnected from herself. When she sat in front of me, I realized something important. Her pain wasn't just physical, it was emotional, it was life-driven. It was accumulated from years of surviving without support. And what she needed in that moment wasn't a new medication. It was a safe place where her story could land. In those first 3 minutes, I didn't rush, I didn't judge, I didn't try to explain her pain away. Instead, I leaned in slightly, softened my tone, and said something she wasn't expecting. Your pain is real, and everyone goes through different phases in life. There are moments of happiness, there are moments of sadness, and moments of anxiousness, when we don't know what the future holds for us. For a brief moment, she froze, as if processing the fact that someone was finally honoring her pain. Her tears softened, her breathing changed, her guard began to fall away. At the end of visit, after pouring her heart out, she stood up and hugged me. Not because I cured anything in those 20 minutes, but because she finally felt to be seen. Not weak, not dramatic, not overreacting, but human and powerful. In the weeks that followed, she returned regularly, not just for medication refills, but because my room had become a space where she could breathe. She would talk about her relentless exhaustion, the guilt of being irritable with her children, her overwhelming academic pressures, her fear of failing at every role she had to play. And each visit, she allowed herself to be a little more vulnerable. Then one day, quietly and carefully, she said, "There is something I never told anyone." And she disclosed her childhood trauma, something she had buried for years, something she had never shared with a doctor. Not because she didn't want to, but because she had never felt safe enough. I didn't extract this information. I didn't push for it. It emerged because safety creates truth, and truth opens the door to healing. So, what happened in those first 3 minutes that changed everything? 3 simple things. 1. I slowed the room down. A calm doctor creates a calm patient. 3 minutes of presence can undo years of medical dismissal. Second, I validated early. A single sentence, "your pain is real," can dissolve walls built over years. I reflected instead of reacting. No advice, no solutions, just reflections like, "It sounds like you've been carrying this alone." Reflection creates safety. Safety creates openness. Openness creates genuine clinical understanding. Before we close today, I want to address something important, especially for the young primary care physicians. Sometimes doctors worry, if I let my patients cry, if I sit down with them for a few minutes, am I becoming their therapist? Maybe I should be seeing someone more medically emergent. Let me be clear. No, you are not becoming their therapist. You are becoming their healer. Primary care is where the mind and body first walk in together. We are the first hands that hold a patient's fear. We are the first eyes that witness their overwhelm. We are the first voice that tells them they are not weak. Letting a patient talk, cry, or unload does not undermine your clinical role. It enhances it. A therapist treats the mind, a physician treats the body. But a healer listens to the story that ties the two together. When you honor that story, even for 3 minutes, you are not doing extra emotional labor. You are practicing medicine in its truest form. Healing begins with connection, and connection begins in the first 3 minutes. Thank you for joining me on The Listening Doctor. Take this with you into your next clinic day. The first 3 minutes are not small talk, they are clinical tools. They are diagnostic windows, and they are healing spaces. Allow them to be human. Allow them to be real. Allow them to work. In our next episode, we'll explore a more powerful companion skill, the power of silence, and why pauses speak louder than words. Until then, slow down, lean in, and listen.